Hi, good evening. Welcome to Wednesday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. So, how's your preparations going? So, we have three exams in this particular month. I mean, November, നമുക്ക് മൂന്ന് exam dates ഉണ്ടല്ലേ. Okay, so how is your preparations going? Prepare ചെയ്യുന്നുണ്ടോ? So, my area is reading, so definitely I should ask about reading. So, what about reading module? Majority of the students are saying reading is the difficult material or the difficult module for them. So please do additional materials for reading every day until your exam. Okay, so as usual today let's start with a sample question from part B, and I'll give you 2 minutes for the completion of this sample question from part B. So here comes the question. So good evening once again. Hi Monita, Divi, Sansi, Neethu, Shanta, good evening. All right. So this is a very familiar question to you guys because this is from the category third category. This is an email. All right. So I'll read the question, then we will discuss the answer. Okay. The purpose of the email to practitioners about infection control obligation system. That is the question. Hi Clarina, good evening. So, yes, hi Akshay, good evening. So what are the keywords from the question? So what are the keywords here? So my keywords from the question which I'm going to underline, which are purpose, practitioners, obligations. Okay. Or you can underline the words practitioners, infection, obligations. Okay. Or you can underline email, infection, obligation. So whatever it is, according to you, it's up to you. You can underline your keywords, but maximum 3 keywords. Clear? The 3 keywords number maximum mark here, not more than 3. Yes. Hi Amrita, good evening. Yes, Amala, good evening. Gopika, good evening. Josna, good evening, Josna. So these are the keywords from the question. So as I already mentioned, this is from the third category, which is an email. So what is an email? Let me know in the comment box. What is an email? What is an email? I'm not asking what are you reading for in an email, or I'm not asking which lines are important. I'm just asking you, what is an email? Or email nu parna enda? What is an email? Let me know in the comment box. Anyone know what is an email? Alright. So, yes, Ganga, hi, good evening. So, email, which means, okay, for example, I am sending an email to Amrita. So, who is the sender here? I am the sender. And who is the receiver? Amrita is the receiver. So, email, which means I am sending an information, a particular information to someone, maybe a person or a group of people regarding a particular matter. ഒരു കാര്യത്തിനെ പറ്റി ഒരാൾക്കോ ഒരു ഗ്രൂപ്പ് ഓഫ് ആൾക്കാർക്കോ നമ്മൾ കൊടുക്കുന്ന ഒരു ഇൻഫർമേഷനാണ് നമ്മൾ എന്ത് പറയുക? ദാറ്റ്സ് കോൾഡ് an email. Okay, so we have formal emails and informal emails. But in this particular module, in reading module, we are using the first one, that is formal emails. What is the significance of emails in this medical context? Clear? So yes, information giving. Yes, Josna, very good. Okay, so we are providing an information to someone. So there will be a receiver as well as there will be a sender. A sender and a receiver will be there. And same like in a memo. Or memo il angane thaneyanu. Alle? Okay. And what are you reading for in an email? Nammal endine vendiyanu or email vaayikkunnathu? What are you reading for in an email? What are you reading for in an email? So email, which means it is from the third category. Okay. And we are reading for the purpose. Okay, purpose, which means the matter, why we are sending this email. So what is the necessity of sending this email? Endinadu send cheynathu? What is the matter? What is the purpose? What is the overall idea? So that is called the purpose. Okay, and which lines are important in an email? The lines are important. Every lines are important, but still when you read an email, you can give a little bit focus to the last lines. Last lines like ningal korchum kuda onu focus kodukka. Okay, so last lines are important. So this is the pattern. So from the third category, email, we are reading for the purpose, last lines are important. Clear? Yes, Shruti, very good. Last line. Yes, Monita, overall idea, last line is important. Yes, Akshay, purpose, we are reading for the purpose. Yes. Okay. Last lines are important. Very good, Akshay. Yes. So that's that. And after reading this question, we can underline the keywords from the question, then we can understand the question. So this is how we are understanding the question through this pattern. So the question is all about practitioners about infection control obligation. So what do you mean by obligation? What is the meaning of the word obligation here? Obligation, which means their duties and, okay, their commitments, duties, regulations. So obligations, which means their duties. Okay. Option A. So when you read a question, always connect with your option, especially if it is an incomplete question. Even this is an incomplete question. Obligation is to, there is no full stop or there is no question mark in the question. So this is an incomplete question. When you read a question, always connect with your option. Connect ചെയ്ത് വായിക്കുക. So that will be more easy and it will be less confusing. Okay, so practitioners about infection control obligation is to act as a reminder of their obligation. So my keywords: act, reminder, obligations. Option B, practitioners about infection control obligations is to respond to a specific query they have raised. So my keywords: respond, query, they. Option C, practitioners about infection control obligations is to announce a change in regulations. These are my keywords. Okay, and as you can see in option B, there is a word they. So ആരാണ് ഇവിടെ they എന്ന് ഉദ്ദേശിക്കുന്നത്? Who are this they, which means? Okay, they, which means the practitioners. Practitioners. So that is they indicates. So coming to this email. Email from Dental Board of Australia. So who is the sender? Who is the sender here? This is Dental Board of Australia. They are the senders. And who is the receiver? Practitioner is the receiver. ഇതാർക്ക് അയക്കുന്ന ഇമെയിലാണ്? പ്രാക്ടീഷണറിനാണ് അയക്കുന്നത്. ആരാണ് അയക്കുന്നത്? Dental Board of Australia. Alright. You may be aware of the recent. Who is this you, which means practitioner? You may be aware of the recent media and public interest in standards of infection control in dental practice. As regulators of the profession, so who are the regulators, controllers of the profession here? Dental Board of Australia. ഇവരാണ് controllers, regulators of the profession. We are concerned that, who is concerned? Concerned, which means tensed, worried. Okay, worried about something. So who are worried? We are worried. That means Dental Board of Australia are concerned that there has been doubt among registered dental practitioners about these essential standards. Anything mentioned about practitioners has some doubts? അവർക്ക് എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടെന്ന് പറയുന്നുണ്ടോ? Not mentioned. Okay, so they are concerned. Dental Board of Australia is worried about something. What about why they are concerned? Because they are concerned that they are thinking, okay, maybe then these practitioners have some concerns regarding or doubts regarding their obligations, their duties. Actually, they don't have any concerns or they don't have any doubts. Our practitioners don't have any doubts. So we can eliminate option B. It is not mentioned. They don't have any doubts. Query, which means a doubt. They don't have any doubt. Registered dental practitioners must comply with the National Board's guidelines on infection control. Comply, which means obey. They should follow. List the reference material that you must have access to and comply with, including the National Health and Medical Research Council, which is NHMRC, guidelines for the prevention and the control for infection in healthcare. We believe that. Who believe that? Dental Board of Australia. Most dental practitioners consistently, continuously, they are comply. They are just following everything, these guidelines, and implement appropriate infection control protocols. However, the consequences for non-compliance with appropriate infection control measures will be significant for you and also for your patients and the community. Okay, and as I can see a lot of fake messages in this comment box, so please don't respond to those messages, okay? Because you can just block them or you can just report them. Yes, so coming back to the paragraph. So what is mentioned here? Especially in the last para, very clearly mentioned, this Dental Board of Practitioners have some duties and regulations, so please do follow it correctly. Yes. So we can trace towards option. This option like option A, act as a reminder of their obligations. Okay, so that is the correct answer. When you get the correct answer, you can bubble the letter. Alright, and what about option B? Already we have eliminated option B. Announce a change in regulations. So where is it mentioned? Announce a change in regulations. What is the change mentioned here? No change is mentioned here. So again, not mentioned. Okay, so as you can see here in this, this screen, there are a lot of red markings on the screen because that much study in a single material. ഒറ്റ ക്വസ്റ്റനിലാണ് ഇത്രയും മാർക്കിങ്സ് ഞാൻ കാണിച്ചു തരുന്നത് അല്ലേ. സോ വി ഹാവ് ടു സ്റ്റഡി എ ലോട്ട് ഓഫ് തിങ്സ് ഫ്രം എ സിംഗിൾ ക്വസ്റ്റ്യൻ. ക്ലിയർ? സോ ഐ എം ജസ്റ്റ് rubbing it off because a lot of markings. So that's all about that. Okay, so answer is option A, act as a reminder of their obligations. That is the correct answer. Okay, then coming back to part B. So how many questions in part B? We have total 6 questions in part B. Okay, total number of questions 6. And what about the type of question? So we have multiple choice questions with 3 answer options. Okay, and what are the chances here? For sure, one option will be the correct answer. Maybe option A, option B, or option C. Yeah, one option will be for sure, it is the correct answer. And what are the rest of the options? What are the chances of options? One will be not mentioned and one will be contradictory or opposite option. It can vary according to the questions. Okay, so answer is option A. A lot of correct answers I can see here in the comment box. Yes, Shruti. Yes, Shanta, Divi, Gopika. Very good. Answer is option A. Very good. Correct answer. Okay, very good. Yes. Any doubts regarding this question? Any doubts regarding part B? Endengilum doubt undo ninge part B il? If you have any doubt regarding part B, you can comment it here or you can ask me in the next live. Naala ninge live il karma chodikam. Allengil you can ask me here in the comment box. I'll reply. Okay. Yes. So coming to the new material which we have today. A self-prepared material for part A, which is dentigerous cyst, related to dental. Yes. Okay, Shanta. Okay, dear. Yes. So dentigerous cyst, that is the new topic which we have. Okay. So in this video, I'm just gonna do some explanations regarding part A for the students who are gonna write this exam on this particular week. I think, yeah, maybe in the next week, 7th, right? Okay, so please do listen properly. നിങ്ങൾക്ക് കറക്റ്റ് ആയിട്ടുള്ള ഒരു സ്ട്രക്ചറും കറക്റ്റ് ആയിട്ടുള്ള ഒരു ഇൻഫർമേഷനും യു വിൽ ഗെറ്റ് ത്രൂ ദിസ് വീഡിയോ. ഓക്കെ, അപ്പോൾ എന്താ നമ്മൾ പറയാൻ പോകുന്നത്? ഇറ്റ്സ് ഓൾ അബൌട്ട് പാർട്ട് എ. ഓക്കെ, ഐ വിൽ ജസ്റ്റ് ഗിവ് യു ജസ്റ്റ് അബൌട്ട് പാർട്ട് എ, ദെൻ വി ക്യാൻ മൂവ് ടു ദ ക്വസ്റ്റ്യൻ ആൻസേഴ്സ്. So what do you guys know about part A? Why we are doing part A? What is the relevance of doing part A? So first of all, that we have to understand. അതാണ് നമ്മൾ ആദ്യം മനസ്സിലാക്കേണ്ടത്. What is the relevance? Why we are doing part A in reading audio? എന്തിനാണ് നമ്മൾ റീഡിംഗ് മോഡ്യൂളിൽ പാർട്ട് എ ചെയ്യുന്നത്? വാട്ട് ഈസ് ദ ഇമ്പോർട്ടൻറ്റ് സിഗ്നിഫിക്കൻസ് ഓഫ് പാർട്ട് എ ഇൻ റീഡിംഗ്? ഓൾ റൈറ്റ്, ആസ് യു ക്യാൻ സീ ഹിയർ ഇൻ പാർട്ട് എ വി ഹാവ് 4 different texts. Text A, text B, text C as well as text D. So we have 4 different texts in part A. So what is the importance of these 4 texts in part A? എന്തിനാണ് 4 text തന്നിരിക്കുന്നത്? And you can consider this 4 texts as 4 situations. 4 situations ആയിട്ട് നിങ്ങൾ കൺസിഡർ ചെയ്യുക. അല്ലെങ്കിൽ these are 4 procedures. Okay, just imagine these are 4 different procedures. Okay, and suppose your manager or your HOD or your in charge is just asking you, or your doctor is asking you to do a procedure which you don't know. നിങ്ങൾക്ക് അറിയാൻ വയ്യാത്തൊരു പ്രൊസീജിയർ ചെയ്യാൻ വേണ്ടി നിങ്ങളോട് പറയുവാണ്. And they are just giving you a booklet. നിങ്ങൾക്കൊരു ബുക്ക് കൈ തരുന്നുണ്ട്. A soft copy, maybe a hard copy, or they're just asking you to Google it. Okay, and they're just giving 4 different procedures. And after that, they will ask you some questions about these 4 procedures. Just imagine. ഈ 4 പ്രൊസീജിയറിനെ പറ്റിയും അവർ നിങ്ങളോട് കുറച്ച് ക്വസ്റ്റ്യൻസ് ചോദിക്കുകയെന്ന് വിചാരിക്കുക. Just imagine they're asking different questions about these 4 procedures. What will you do? നിങ്ങൾ എന്ത് ചെയ്യും? If you are a student who clearly know what is part A, definitely you can answer those questions. Why? Because you know part A. What is part A? Okay, and already they have set a period. ഒരു ടൈം പീരീഡ് അവർ സെറ്റ് ചെയ്തിട്ടുണ്ട്. ഫോർ എക്സാമ്പിൾ they have set 10 minutes time. ഒരു 10 മിനിറ്റ് അവർ സെറ്റ് ചെയ്തിട്ടാണ് they are asking some questions. Okay, so if you are a student who clearly know about what is part A, definitely you can answer whatever questions they are asking you within this 10 minutes of time, because you know what is part A. Okay, ഇപ്പോൾ part A എന്ന് പറയുന്നത് എന്താണ്? It's all about when they give a particular soft copy or a hard copy or whatever, a booklet or something regarding these 4 procedures, you can just skim and scan. നിങ്ങളത് പെട്ടെന്ന് വായിക്കുക. You can just fast read it and get or collect some idea. കുറച്ച് ഐഡിയാസ് കളക്ട് ചെയ്യുക. You can grasp certain ideas from these 4 texts. ഈ 4 ടെക്സ്റ്റ് ഒന്നും അല്ലെങ്കിൽ 4 പ്രൊസീജിയറൊന്നും നിങ്ങൾ കുറച്ച് കാര്യങ്ങൾ ഗ്രാസ്പ് ചെയ്യാം. Okay, grasping and what you guys are grasping from these four texts? Actually, the important things, important words. Okay, so what are the important words from the first procedure? Text A you can consider, as I already mentioned, you can consider it as a first procedure. For first procedure, എന്തൊക്കെ important words ആണുള്ളത്? And you will remember, okay, so these are the important words in first procedure. And they are asking some questions from the second procedure. Again, you know, okay, these are the important words from second procedure. And from the third one, again, you guys know, okay, these are the important words from third procedure. And we have fourth procedure. Okay, again, we are collecting some important words from the fourth procedure. This is how we are gathering certain informations. So when they ask you questions regarding for these four procedures, definitely you guys know that, okay, this procedure is from this category. These informations are from this particular procedure. So likewise, we are reminding something, remembering something. Okay, so here part A is all about etra text aanu? We have 4 different texts in part A. Okay, appo nammal valare simple aayittu കാര്യങ്ങൾ കണ്ടാൽ മതി. Don't make it very complicated. അപ്പോഴാണ് ഇത് ഭയങ്കര ഡിഫിക്കൽട്ട് ആയിട്ട് തോന്നുന്നത്. ഓക്കെ, ഇറ്റ് ഈസ് എ വെരി സിമ്പിൾ. റീഡിംഗ് ഇസ് ആക്ച്വലി എ വെരി സിമ്പിൾ തിങ്. സോ പ്ലീസ് ഡു മേക്ക് ഇറ്റ് വെരി സിമ്പിൾ. ഓക്കെ, അപ്പോൾ 4 ഡിഫറെൻറ്റ് പ്രൊസീജിയേഴ്സ് തന്നിരിക്കുകയാണ്. ഈ 4 പ്രൊസീജിയേഴ്സിനെ പറ്റിയും നമ്മൾ എന്തായാലും അറിഞ്ഞിരിക്കണം. സോ പ്ലീസ് ഡു കളക്ട് സം വേർഡ്സ് ഫ്രം ദീസ് പ്രൊസീജിയേഴ്സ്. Then you can answer to the questions. That's it. Okay, so likewise we have 4 different texts in part A. Text A, B, C and D. And you guys are collecting certain important words from these 4 texts. ഈ 4 ടെക്സ്റ്റൊന്നും നമുക്ക് ഇമ്പോർട്ടൻ്റ് എന്ന് തോന്നുന്ന കുറച്ച് വേർഡ്സ് നമ്മൾ കളക്ട് ചെയ്യുന്നു. According to these important words or these key words, we are trying to answer these questions. And how many questions we have? We have total 20 questions in part A. Okay, മൊത്തം 20 questions ആണ് നമുക്കുള്ളത്. Yes. So we have 20 questions in part A. Yes, 20 questions in part A. And this 20 questions they have categorized into 3 different sessions. Adam, they are just analyzing, okay, what is the mental ability of the students, whether they are able to answer these questions within this period of time. ഈ തന്നിരിക്കുന്ന സമയത്തിന് ഈ തന്നിരിക്കുന്ന category of questions answer ചെയ്യാൻ കുട്ടി able ആണോ? Okay, so that is what they are analyzing. So 20 questions, 3 categories. 1 to 7, match the following. 8 to 14, short answer questions. 15 to 20, fill in the blanks. So this is the category. Okay, so coming to, all right. Okay, Tina, hi ma'am, I cleared my OET. However, I love to hear your voice. Okay. Thank you so much, dear. Anyway, and congrats. Okay, so sorry I forgot it. Congratulations. All right. So yes, so what about these 3 categories? Match the following, short answer questions, as well as fill in the blanks. All right. Okay, so you can collect some keywords from the text through the method called skimming and scanning. That is fast reading and collecting important words. You can collect certain words according to a particular strategy or a particular structure. ഒരു പ്രത്യേക സ്ട്രാറ്റജിയിൽ നമുക്ക് കീവേഡ്സ് കളക്ട് ചെയ്യാം. ഇറ്റ് വിൽ ബി ഈസി ഫോർ യു. ഇതാണ് ഞാൻ ആദ്യം പറഞ്ഞത്. ദിസ് ഇസ് വാട്ട് ഐ ടോൾഡ് യു ഇനീഷ്യലി. ഇഫ് യു ഗൈസ് ആർ സെറ്റിംഗ് എ പർട്ടിക്കുലർ സ്ട്രക്ചർ ഫോർ എവറിത്തിങ്, എല്ലാ കാര്യങ്ങൾക്കും നിങ്ങളൊരു സ്ട്രക്ചർ പ്ലാൻ ചെയ്താൽ ഇറ്റ് വിൽ ബി ഈസി. അപ്പോൾ നിങ്ങൾ റൈറ്റിംഗ് ചെയ്യുമ്പോൾ യു ഹാവ് എ സ്ട്രക്ചർ, യു ഹാവ് എ സ്ട്രാറ്റജി, യു നോ വാട്ട് ആർ ദ മെത്തേഡ്സ്, അല്ലേ? While you attend speaking also, you know what are the methods, what are the strategy, എന്തൊക്കെയാണ് criteria. Okay, likewise in listening also you have certain structure. So when you do something, please do focus on the structure. ഒരു proper step by step procedure ആയിട്ട് നമ്മൾ പഠിച്ചാൽ it will be very easy for you. So please do study reading module step by step as a step by step procedure. All right. Okay, so I'll read this text A, B, C and D, then let's collect some important words from each of the text. A dentigerous cyst is a fluid-filled sac that forms around the crown of the unerupted permanent or adult tooth. It is a type of dental cyst that affects your jaw. Dentigerous cysts most commonly affect impacted wisdom teeth, but they form around any tooths or still trapped in your jawbone. A dentigerous cyst attaches near the neck of your tooth, then where the root meets the crown and balloons out around its crown. On a dental x-ray, it sort of looks like a semicircle drawn around the top half of your teeth. You can have a dentigerous cyst and not yet healthcare providers usually detect them on imaging tests taken on other reasons. Dentigerous cysts are not typically dangerous, but they can damage your surrounding jawbone and nearby teeth if it is keep growing. It is usually a good idea to treat a dentigerous cyst even if it is small. Jaw cysts are rare overall, but among them, dentigerous cysts are the most common. People usually develop them in their 20s or 30s, but anyone can get them, including children. Symptoms of dentigerous cyst may include gaps or spaces between the affected teeth, shifting or displaced teeth, swollen gums, teeth sensitivity. Okay, so these are the bullet points. So, see, what is the strategy for underlining the keywords? You can underline all the headings mentioned. All headings we underline. Second, you can underline all the subheadings. Okay, complications, you can underline all the subheadings. Third, you can underline all the numbers. So whatever numbers they've mentioned here, you can mark all the numbers, 20s, 30s, half, 1, 2, whatever. And what is the fourth one? You can underline all the signs and symbols. I think there is no sign and symbol mentioned here. For example, greater than, equal to, less than, more than. Okay, so that is signs and symbols. And fifth one is all the names. Whatever names they've mentioned here, you can mark all those names. Alright. Then sixth one, please do underline all the abbreviations or short forms. Then all the brackets mentioned. Definitely they can ask questions from brackets. Okay. And seventh one or eighth one is, you can underline all the words which is italicized or bold words. Okay. Then the words which indicate time showing words, time related words, now, currently, presently, before, early, delay, after, during, all the words. And the words which indicate experiment related words, diagnosis, procedure, identify, okay, clinical observation, so the words. Then the words which indicate research related words, study, population, criteria, aspect, okay, strategy, structure. Then the words that can be not a word, you can underline the first and last line of each and every paragraph as well as all the bullet points. So this is the structure we are following. Okay, to underline the keywords. And yes, coming back, if left untreated, a dentigerous cyst can lead to a number of complications including infection. The cyst can fill up pus and bacteria forming an abscess. If the abscess bursts, it can lead to blood poisoning or septicemia. Tooth loss, the cyst can weaken the gum tissue, making it difficult for tooth to stay in place. Then jaw fracture will be there. A cyst can weaken the jawbone, making it more likely to fracture. The risk of fracture is higher if the cyst is in premolar region. And then ameloblastoma, this is a rare non-cancerous jaw tumor that can develop from the cells that form enamel. If left untreated, the swelling can become cancerous and spread to lymph nodes or lungs. Other tumors, the cyst can lead to development of squamous cell carcinoma or mucoepidermoid carcinoma. Bone deformation, the cyst can cause permanent bone deformation or extensive bone destruction. Okay. Then with proper treatment, an outlook for dentigerous cyst is excellent. The cyst is unlikely to reoccur and there is a very low chance of further complications. So that is all about my keywords from text B. Then text C. And one more important thing we should remember while doing part A, don't skip any line. Oru line polum skip cheyirudhu. Okay. And majority of the students have this tendency, okay, endayirikkum question, what is the question, okay, whether I am able to answer the question, എനിക്കത് ചെയ്യാൻ പറ്റുമോ, ഇതാണ് നമ്മുടെ thought. Okay, and so the ക്ലാസ്സിൽ ഇരിക്കുന്ന സമയത്ത് അല്ലെങ്കിൽ when you are going to write this exam, your complete thought is all about the time as well as, okay, what will be the എന്തായിരിക്കും question, easy ആയിരിക്കുമോ, tough ആയിരിക്കുമോ, എനിക്ക് ഈ ടൈമിനുള്ളിൽ ചെയ്ത് തീർക്കാൻ പറ്റുമോ. These are the things or thoughts which you have. Forget about it. അത് നിങ്ങൾ മറന്നേക്ക്. Because what is important here, please do read each and every line from text A, B, C and D. See, procedure എന്താണെന്ന് അറിഞ്ഞാലേ ഡോക്ടർ ചോദിക്കുന്ന ക്വസ്റ്റ്യൻസിന് ആൻസർ ചെയ്യാൻ പറ്റൂ, ശരിയല്ലേ? If you know the procedure, then only you can answer whatever the doctor is asking you. Okay, so understand the procedure first. അപ്പോൾ അതുപോലെ എന്താ ടെക്സ്റ്റ് എന്നുള്ളത് ആദ്യം ഒന്ന് മനസ്സിലാക്കുക. Then you can go to the questions. Okay, text is C. It's all about diagnostic of dentigerous cyst in the jaws. Then lesions less than 1 centimeter diameter, lesions with diameters between 1 to 7 centimeters, then 8 to 10 centimeters. more than or equal to 11 centimeter. Then curettage plus with or without extraction of the etiologic dental organ. Radiographic controls every 6 months. Then nucleation, then curettage, then nitrofurantoin, ointment 0.2 gram or 100 gram plus with or without removal about the etiologic dental organ. Then marsupialization with or without adjuvant treatments with or without extraction from the etiologic dental organ. Then adjuvant resection and treatment extraction of the etiologic dental organ. Okay, so not that much lengthy, but a lot of numbers. And text study is all about a study. Okay, there is study on. So combined database search. Then 2815 articles, 92 articles required for the further review. Abstract reviews mentioned here, further reviews mentioned here. Then excluded number 2723 cases were not bilateral, not indigenous, is not human study, not clinical cases were duplicate. Okay, then 10 articles unable to access included using data sourced from review. 82 articles full text review, 55 articles included, 65 articles in total included, 27 articles excluded. Non-bilateral, which is number 22, not indigenous, which is number 4, data duplicated from prior publication, which is 1. So these are the numbers mentioned in text study. Okay, so now I am moving to the questions. Okay, so let's face the questions. Ini namukku questions face cheyam. So you don't have to worry about it. It will be very easy. Trust me. Okay. First one. Probability of recurrence of a dentagerous cyst after treatment. Reoccurrence. Reoccur. Where you have seen this word reoccurrence? Probability, reoccurrence, treatment. നമ്മൾ എവിടെയാണ് ആ ഒരു വേർഡ് കണ്ടത്? Where you have seen that word recurrence. Reoccurrence. After the treatment. Yes, Shanta, very good dear. Correct answer. Anyone else with the correct answer? Erarkengilum correct answer kittitundo? No, only Shanta. Okay, very good. Answer is from text B. Okay, Devi, very good Devi. It's from text B. Okay, and where is it mentioned in text B? So this is all about the recurrence of the condition, especially see the last line, with proper treatment. Outlook for a dentagerous cyst is excellent. The cyst is unlikely to reoccur. And there is a very low chance of further recurrence. The chance is very low. Okay, so answer is from text B. Very good, Gopika. Okay, next one. Yes, Mohanida, it is text B. Very good, dear. Next one. Who is responsible for blood infection post dentagerous cyst? So, who responsible blood infection? So, these are my keywords from second question. Okay, so where is it mentioned? Who is responsible for the infection, blood infection post dentagerous cyst? Any idea? Second question, where is it mentioned? Yes, okay, Josna, yes, Divi, which is mentioned again in text B. You can repeat, very clearly mentioned here. Decide which text, A, B, C or D, information comes from. You may use any letter more than once. Only kududal thavana use cheyam. You can repeat. Repetitions may be there. Will be there. Okay, so B again, which is mentioned in text B. Okay, which is mentioned here in text B. Infection. The cyst can fill with pus and bacteria, forming an abscess. If the abscess burst, it can lead to blood poisoning. So answer is mentioned in text B. Third one. Yes, Monita. Yes, Gopika. Yes, Shanta, Sansi, Divi. Correct answer. Third one. How many reviews needed further research? So how many reviews and research? Yeah, so what about the answer? Yes, Josna, very good dear, which is mentioned in text D. Okay, and text D is all about a study. Alle study na pattiyana paranjirikkunne. So in text D very clearly mentioned, what is mentioned? 92 articles required for further review. Alle? So answer is here in text D. Okay. Yes, Gopika, Monida, Sansi, Divi, Shanta. Text D is the correct answer. Fourth one. Which type of dentagerous cyst requires cream to get rid of it? Cream, which means instead of cream, maybe in the paragraph it is ointment. Any ointment is mentioned here? ഏതെങ്കിലും ഓയിൻമെൻറ്റ് പറയുന്നുണ്ടോ? യെസ്, വിച്ച് ഇസ് മെൻഷൻ ഹിയർ ഇൻ ടെക്സ്റ്റ് സി. ഓക്കെ, nitrofurantoin ointment. Okay, so answer is mentioned in text C, right? Yes, Nancy, Divi, Josna. Yes, Shanta, it is text C. Okay, fifth one. What are the physical features of dentagerous cyst? So physical features, which means what is another word for physical features? Symptoms. Okay, indicators. Okay, so those are physical features, the symptoms they are looking for. And where is it mentioned? Fifth one. Yes, which is mentioned in text A. Very good, Sansi. Yes, Josna, which is from text A. Symptoms of dentagerous cyst may include gaps or spaces. That is a physical feature. Shifting, swollen gums, teeth sensitivity. So it's mentioned in text A. Sixth one. What type of cyst require the essential removal of an etiological dental organ? Etiological dental organ. If you know these three words, definitely you will get the correct answer. Yes, Monida, Gopika, Shanta, Divi, Sansi. Yeah, yes, Josna, it is from text A. And what about sixth question? Yeah, sixth question is mentioned in text C. So we have two diagrams or two pictorials here. So in text C, yeah, from this these texts, etiologic dental organ, so that's mentioned in text C. Okay, so answer is from text C. Which age range is mostly affected by dentagerous cyst? So age range affected. Yes, Monita, Gopika, Shanta, which is from text C. Yes, very good. Seventh one answer. What about question number 7? Where is it mentioned? Yes, Josna, very good dear, which is from text A. A is the correct answer. Second paragraph. Where is it mentioned in the second para? People usually develop them in their 20s or 30s. Answer is mentioned in text A. Okay, so these are the correct answers. So B, B, D, C, A, A. Yes. Okay, Monita, yes, Devi, Sansi, Shanta, Josna, text A. All right. So coming to 8 to 14 set of questions. So short answer questions. So please do remember, your answer should contain maximum 2 to 3 words, not more than 3. Okay. So recommended dose for nitrofurantoin ointment. Okay. So again, already we have seen this ointment, and what is the dose of this ointment? Where is it mentioned? Either text il parayunne. Very good, Monita, 7 out of 7. Very good, dear. Okay. So what is the dose mentioned? Etrana dose mentioned cheyidikkunne? So ointment is mentioned here. Yes, ointment is, the dose is 0.2 gram or 100 gram. Okay, so you can write 0.2 gr or 100 gram. Okay, yes, that is the correct answer, which is from text C. No, okay. The ninth one, number of articles got evicted in the initial phase. So how many articles excluded in the initial stage? Etra articles are excluded? The study mentioned in text D. So the number of articles excluded, etra articles excluded in the initial stage. So this is the first stage and this is second. Okay, so how many articles excluded here? Combined, that is a total combined database search, 2815 articles. They are asking how many articles excluded in the first stage. This is the first stage. How many articles excluded here? It is 2723. Okay, so the number is 2723. Okay, yes. Yes, Shanta, which is equal to 2723. We can write both those, ma'am, for 8Q. 8th question, yeah, yes, you can write both, because 0.2 gram is one, 100 grams is another. You can either, it is or, yeah, it is mentioned here, either you can write 0.2 grams or you can 100 gram or you can write both, no problem, not a very lengthy answer. Okay. Yes, Monida, correct answer. 10th one. How many articles were non-reachable after the further analysis? So, you guys will think, okay, this is the same question, not the same. Look like the same, but not the same. How many articles were non-reachable after further analysis? Yes. എത്രയാണ്? 10th one. Okay, so 10th question, answer is 10. Okay, yes, 10, 10. Okay. 10th question answer is 10. Very good. And where is it mentioned? 10. 10 articles unable to access, collect, reachable. So answer is 10. Okay. Then 11th one. Which part is mostly affected by a dentigerous cyst? So which part? Mostly affected. So part mostly affected. Yes, which part is mostly affected? And I think answer which I've seen in text A, because that's all about this condition. So in text A, impacted wisdom teeth. So where is it mentioned? Okay, dentigerous cysts commonly affect impacted wisdom teeth, and this is the answer. Okay, answer is mentioned in text A. Answer is impacted, okay, and wisdom yes, teeth. Okay, 12th one, and this is from text A. 12th one, how often? Yes, the V, Shansi, not wisdom teeth there, impacted wisdom teeth. Okay. Yes, Shansi. Okay, Shanta and Josna, impacted wisdom teeth. Very good, very good. All right, then 12th one, how often should have to consider radiographic controls during the management of dentigerous cysts? So, how often? How often, which means the frequency, how many times? Consider radiographic and management. So these are my keywords. How often? Very good. Every 6 months. See, I've started my first question in first letter capital I. So that is why I am continuing my every answers first letter capital. Kandalla. And if you guys have started the first letter small here, you can go through all these questions, like you can start with small letter. Okay, 13th one. Yeah, so where is it mentioned? Every 6 months. And answer is mentioned in text C. Yes, Josna, Divi, Shanta, yeah, that's mentioned in text C, every 6 months. Okay, every 6 months. Yes, in this box. Okay, and what about the next one? 13. The rare non-cancerous jaw tumor can develop from the cells that form enamel. So, rare non-cancerous enamel. What is the correct answer? Something related to enamel which I have seen in text B. One of the complication, I guess. And here is enamel mentioned. So, answer is ameloblastoma, right? This is a rare non-cancerous jaw tumor. So, answer is ameloblastoma. Okay, ameloblastoma from text B. So, answer is ameloblastoma from text C. That's my answer. 14th one. The pattern which the dentigerous cyst may appear around the top half of the tooth. Yes. Pattern in which, so what is the pattern? A circle pattern or a semicircle pattern or a triangle, whatever it is mentioned, I don't know. Okay, and I've seen a semicircle, that word somewhere in text A. So I think maybe that is the answer. In first paragraph, I've seen somewhere here. Yes, see, already I've underlined that word. So on a dental X-ray, it sorts of looks like a semicircle drawn around the top half of your teeth. So answer is semicircle. Yeah. You don't have to write that drawn, dear. Answer is semicircle. A pattern ആണ് അവർ ചോദിക്കുന്നത്. See, short answer question. So what is the pattern? Semicircle. Okay, so answer is semicircle. And this is a single word, right? Not a different word. Okay. Yes, Monida, Josna. Yes, Sansi, Divi. Shanta, yes, semicircle. Okay, Sansi, you can write everything in small letter. That's also good. Okay, yes. Yeah, so coming to next one. 15 to 20. 15. On a dash, The dentigerous cyst looks like semicircle drawn around the top half of your teeth. Same question. So what is the missing word here? On a dash. On a what? On a what? So what is the answer? On a what? So again same line. On a dental x-ray. So answer is dental x-ray. So my answer is here, which is dental x-ray. Okay, this is my answer. Okay, again from text A, a direct answer. 16th one, yes. Okay, Sansi, yes, Shanta, yes, Divi, Josna, dental x-ray. Okay, 16th one. If left untreated, the dash can become cancerous and spread to the lymph nodes or lungs. So what is the missing word here? If left untreated. Yes, very good, Divi. It is swelling. Okay, it is swelling, and which is mentioned in text A. Ano? Yes. Sorry, text A, it's mentioned in text B. And if left untreated, the swelling can become cancerous and spread to the lymph nodes or lungs. So answer is swelling. 17. Yes, Josna. Yes, Shanta. Sansi, it is swelling. 17. Among 27 articles excluded, in the final phase of dash of them were the duplicate from the prior publication. So dash of them were duplicate. How many of them were duplicate? So maybe from text D, I guess. From the second phase. So this is the first phase. This is the second phase. And 27 included non-bilateral 22, non-dentigerous 4, that data duplicated from prior publication, which is 1. Okay, so answer is 1. So either you can write 1, okay, or you can write 0, 1. Both are correct. Okay, either you can write 1 or you can write 0, 1. Then 18th one. The risk of jaw fracture is higher if the dentigerous cyst is in the dash. In the what? 18th one. Yes, Monita, which is correct. Yes, Josna, 1. You don't have to write n equal to 1. It is just 1. Okay. Yes. Okay, Sansi, it's not. Yeah. Data. Yes. Okay. So, 18th one. Answer is premolar region. Okay, that is the correct answer, and it is mentioned here in text B. And here, jaw fracture, the cyst can weaken the jawbone, making it more likely to fracture. The risk of fracture is higher if the cyst is in the premolar region. I think already da is mentioned, right? Question da mentioned cheyiditille. Yes, already da is here. Article is here. So you can write premolar region. 19th one. Lesions greater than dash in a diameter require adjoint resection, treatment plus extraction of etiological dental organ. So what is that one? Lesions greater than dash. Greater than 11. Okay, yes, greater than 11 centimeter. Yes. Okay, Monita, premolar region. Yes, Diya. Yes, Sansi. Okay, Shanta and Sansi. Yes, it is 11. See, Sansi, greater than is already there in the question. Kanda, already question on the greater than. So don't write greater than symbol. Already it is mentioned in the question, so that you can write just 11 centimeter. Okay, answer is 11 centimeter. Okay, just it's not 11 centimeter, which is mentioned here in text C. See, Kanda, greater than 11 centimeter. Okay, 11 centimeter. Last one. Dentigerous test can damage the surrounding dash and nearby teeth if they keep growing. So what is the correct answer here? Surrounding what? And I think answer is jaw bone, right? Yes, jaw bone. Okay, and I got this answer from text A. And which is mentioned here already. I think I've underlined the word here. Yeah, jaw bone. See? But they can damage your surrounding jaw bone and nearby teeth if they keep growing. So already I've underlined that. So definitely I'm 100% sure whatever keywords that you guys are underlining according to my strategy or whatever I've told you according to this academy's strategy, definitely you can score 20 out of 20, no doubt. Okay, what is Amshila? So please do underline all the important words according to the strategy which I've told you. Okay, so that's all about today. So happy Diwali in advance. So take care. See you tomorrow. Yes, hi Chanda. Okay, 20 out of 20. Very good, dear. Yes. So thank you. Take care. Bye.